Good afternoon, everyone, and thank you for joining us. My name is Kara Vandigrift, and I am a program coordinator here at Prevention Partners. I'd like to welcome all of you to today's webinar, 60 Minutes or More a Day, where kids live, learn, and play. Today we're going to be discussing the Physical Activity Guidelines for Americans Midcourse Report that was just released in March of this year. Before we begin, I'd like to just address a few webinar logistics. First, in the lower left-hand corner of your screen, you'll see a chat box. This will be available throughout the webinar for any questions or technical issues that come up. Also, you'll notice on the top of the slide in the upper right-hand corner, we have a hashtag that if you'd like to tweet about today's event, please use the hashtag PA Guidelines. This webinar is being recorded and will be archived, so if you had colleagues or friends of yours that were unable to attend today, or you'd like to share what you hear today with someone else, those will be available following the webinar, and you will receive a link sent to your inbox after today's webinar. In the upper right-hand corner of your screen, you'll see a Files pod, and in that Files pod, you do have access to the webinar slides, and what you can do is just go ahead and highlight that and click Download File, and that will give you access to today's slides. We have also linked in our web links pod a number of different resources that are also available to you. We have a link to the Prevention Partners homepage, as well as some of the other links that will be coming up today. We also welcome your feedback and would love to hear from you about today's presentation, and so there is a link to our webinar evaluation, or if you would like more information about some of the programs that you hear about today, you can fill out that form that's attached with the webinar evaluation to get more information. So we have a very full agenda for you here today. First, I would like to again welcome all of you for joining us. And I think we have representation from almost all 50 states that registered here today, so we're excited to see that. What I'll do first is go ahead and tell you a little bit about Prevention Partners, and then I'll turn it over to Dr. Katrina Piercy with the U.S. Department of Health and Human Services to tell you a little bit more about the Physical Activity Guidelines for Americans Midcourse Report. We will also hear from Georgi with the Fort Worth Independent School District to hear about how they're implementing physical activity in their district, as well as Principal Martin McDonald with Jordan Matthews High School in Siler City, North Carolina, to tell us a little bit more about JETS time. And then we'll also hear from Dr. Sarah Lee with the Center for Disease Control regarding resources and tools that are available to you as well. And we're hoping to leave a little bit of time for some question and answer and then close with our evaluation. So before we get too far along, we'd like to hear a little bit more from you and where you're calling in from. So in just a moment, you're going to see a poll pop up on your screen. And if you would, just go ahead and click where you are calling in from here today. I'll give you just a few minutes to go ahead and populate that. Great. Looks like we have a pretty broad mix of folks joining us today. Several from education, healthcare, just general community, as well as some other sectors as well. So great. Thank you again all. Thank you all again for joining us here today. So for those of you that are not familiar with Prevention Partners, I wanted to take just a few minutes and tell you a little bit about our organization and the work that we do. We are a 15-year-old nonprofit organization based in Chapel Hill, North Carolina, and we primarily work at the state and national levels to address the leading causes of ill health and early death stemming from poor nutrition, tobacco use, and physical inactivity. We work with over 500 organizations across 18 states, with our primary initiatives currently being located in North Carolina, South Carolina, Virginia, New York City, and Oklahoma, as well as the children's hospitals across all 50 states. Our community of learning spans across a variety of sectors, including schools, hospitals, businesses, and state agencies, and our unique approach works to engage leaders and executive leadership to make fundamental, sustainable changes to the organizational infrastructure to make long-lasting, sustainable change to change lives. and ultimately making the healthy choice the easy choice. Our work has been built through a variety of partnerships, and it continues to grow. The Be Active Legacy Fund is making today's event possible. Be Active North Carolina Legacy Fund was established within Prevention Partners about 6 months ago when Be Active North Carolina folded its organization into ours. And the Legacy Fund is really enabling and allowing us to enhance and increase our focus on physical activity, and is perfectly aligned for us to share the new and emerging science, particularly that which is highlighted in the Midcourse Report today. North Carolina Prevention Partners has been working in schools for the last 10 years to promote healthy school environments, and we do that through 3 primary initiatives that are listed here: NC School Health Connection, Zone Health, and Work Healthy America, and I'll tell you a little bit more about those in just a minute. We really work through a top-down approach, starting with state leadership and those working through districts, faculty, and staff, and all of those who are touched by the school system. NC School Health Connection is our state-level leadership engagement tool, and I'll tell you more about that in a moment. Zone Health supports student wellness, and Work Healthy America focuses on staff wellness. NC School Health Connection is a statewide collaborative website that was developed by NC Healthy Schools and Prevention Partners as a strategic planning approach that identifies the number of organizations working on school-based wellness initiatives within each county across the state. And you can see here the numbers of organizations working there. And you can also click on the picture there to bring you directly to the website. Our mission with this site is to identify and promote effective childhood obesity prevention programs using a web-based interactive map that really empowers key stakeholders and encourages collaboration for those that are seeking to improve student health and academic achievement. The site was launched in 2010 with the endorsement of 15 agencies that work with schools across North Carolina to help build healthier places for youth. We worked with the schools to gain input to develop a site that is most useful in connecting schools with the valuable resources that they need. And currently there are 22 organizations that are represented on this map. And we're also proud to announce that we just received the Web Health Information Resource Center's Web Health Award for 2013, which honors the nation's best digital health resources. And another primary program that we use within schools is the Zone Health program. And Zone Health is our school-based obesity prevention program that was started in 2003 in North Carolina with a generous grant from GlaxoSmithKline's Community Partnership. Zone Health is an online assessment tool that schools and districts can use to promote healthy school environments for students and staff, and addresses these 4 key areas of wellness, so focusing on leadership and policies, healthy food environments, health education, and physical activity. And schools take an online web-based assessment and receive a grade, A through F, just like a report card in school, to tell them how they're doing in each one of these wellness areas. We then provide tailored tools and resources to help them make improvements to those areas, and then provide ongoing assistance to continue working towards straight A's in all of these key areas. So I would now like to turn it over to Dr. Katrina Piercy, who will tell you more about physical activity in schools and the Midcourse Report and strategies to increase physical activity among youth.
Thank you, Kara. I'm pleased to be here on today's webinar. As Kara mentioned, I work with the Office of Disease Prevention and Health Promotion within HHS. I also had the pleasure of serving as the coordinator for the Physical Activity Guidelines Midcourse Report. And since I'm going to be covering several topics today in a fairly short amount of time, I wanted to include a brief outline to highlight some of the areas that I will be addressing. My topics include the Physical Activity Guidelines for Americans, which I'll be abbreviating as PAG, the PAG Midcourse Report findings, specifically more details about the school findings from the Midcourse Report, the National Physical Activity Plan educational strategies, Let's Move Active Schools, and some specific success stories from their program, and also just overall discussing strategies and implementation plans for increasing physical activity among youth. So I'd like to start with the Physical Activity Guidelines for Americans. These were released in 2008. It It was an effort coordinated and released by our office, the Office of Disease Prevention and Health Promotion. And these guidelines that came out were the first federal guidance on the amounts and types of physical activity for overall health benefits. Now, the guidelines are intended for youth or for Americans ages 6 and older, but for the purpose of today's presentation, I'm focusing specifically on the youth population. So the slide you're seeing is the recommendations for youth ages 6 to 17. So the guidelines recommend that youth get at least 60 minutes or more of physical activity each day. And it's important to note when I move on to discuss the Midcourse Report that does not change the recommended amount of time. And an important thing to note with the youth recommendations is that it's important to incorporate a variety of activities, including aerobic, muscle strengthening, and bone strengthening activities. Moving on to the Physical Activity Guidelines Midcourse Report, Strategies to Increase Physical Activity Among Youth. As mentioned previously, this was released this past March by our office along with the President's Council on Fitness, Sports, and Nutrition, the CDC, and the NIH. And the goal of this report was to continue the science-based messages of the Physical Activity Guidelines about how much physical activity is needed, and to compile strategies of what works, specifically to increase physical activity among the youth population ages 3 to 17. Therefore, we did a review of reviews to identify 5 areas to increase physical activity where youth live, learn, and play. A subcommittee of experts on physical activity was compiled to complete this report. You'll hear later from Dr. Sarah Lee, who is one of the members of the subcommittee. Overall, this report highlights successful interventions and research needs within the school setting, preschool and child care setting, community, family and home, and the primary care settings. This slide provides a high-level overview of the key findings from the PAG Midcourse Report, and I'll read through each of these just to touch on the key points. School settings hold a realistic and evidence-based opportunity to increase physical activity among youth and should be a key part of the national strategy to increase physical activity. Preschool and child care centers that serve young children are an important setting in which to enhance physical activity. One unique piece of the PAG Midcourse Report was the inclusion of the preschool ages 3 to 5 in this report. There was not sufficient evidence to make a specific recommendation for this population in the Physical Activity Guidelines released in 2008, but the subcommittee felt strongly that it was important to include this population, as this is an area where lifelong habits can be developed. Third is talking about the built environment, and changes within this area with multiple sectors were found to be promising. And finally, to advance efforts to increase physical activity among youth, key research gaps should be addressed. For the purposes of today's webinar, I'm going to focus my attention on the school setting. The key intervention strategies and research needs for each setting are also found in the executive summary and the full PAG Midcourse Report. The executive summary also provides a great resource to share with stakeholders about what works in specific settings, and you can find the link under the File tab. So focusing on the school setting, this was the area where the strongest evidence was found. And in this area, there's more than 55 million youth enrolled in school, and a typical school day is 6 to 7 hours. This makes school a prime opportunity to integrate physical activity into the school day. In addition, there's growing literature on physical activity and academic achievement, as highlighted in a 2010 CDC report on the association between school-based physical activity, including physical education, and academic performance. A common misperception is that students are getting physical activity during school within PE. However, the statistic highlighted at the bottom of this slide shows the low numbers of students who have the opportunity for daily PE. It's only happening in 4% of elementary schools, 8% of middle schools, and 2% of high schools. So there's a tremendous opportunity to increase physical activity options within the school setting. For the PAG Midcourse Report, the school setting was divided into 6 subsettings, as listed here on the slide, and includes multi-component school-based interventions, PE, active transportation to school, which includes walking or biking, activity breaks, the school physical environment, and after-school interventions. For today's presentation, I'll focus more specifically on multi-component school-based interventions and physical education, since these were the areas with the most evidence. Multi-component interventions include 2 or more intervention strategies that are concurrently implemented. And as you see on this next slide, this shows several of the effective strategies for multi-component school-based interventions. As you notice, several of these are the same as some of the subsettings. So in a multi-component intervention, they're often combining a few different pieces, such as enhanced PE, classroom activity breaks, developing activity sessions before and or after school, building behavioral skills with a focus on teaching overall skills to engage in physical activity rather than a focus on sport-specific skills. And finally, providing after-school activity space and equipment was found to be a key strategy to increase physical activity within the school setting. One of the first bullets on the previous slide was providing enhanced PE, and I wanted to take a moment to discuss what the subcommittee used as their definition for enhanced PE. This definition was compiled based on previous systematic reviews and intervention studies. And it's important that students not only have regular physical activity during the school day, but really the subcommittee felt strongly that it needed to include several of these components of enhanced PE opportunity. So this includes the amount of time that students are engaged to moderate to vigorous to physical activity. So the overall time of the PE class is important, but it's also important the amount of time and the intensity level that students are doing the activity. It's also important to modify activities to ensure PE is inclusive for all, such as changing around a game of softball so that all students run the bases instead of only the person at bat. And again, there's also a focus on increasing knowledge and building overall physical activity and health skills. Next, on these next 2 slides, I'm going to describe a little bit more about the National Physical Activity Plan and how their educational strategies fit in nicely with the findings from the Midcourse Report. So, to provide a little background information on the National Physical Activity Plan, it's a comprehensive set of policies, programs, and initiatives to increase physical activity. This was released in 2010, so following the release of the Midcourse Report in 2008. And the vision of the National Physical Activity Plan is that one day all Americans will be physically active and they will live, work, and play in environments that facilitate regular physical activity. I hope many of you were able to join the previous North Carolina Prevention Partners webinar in August, which had additional information on the National Physical Activity Plan and is archived on their website. This first slide here shows 3 of the 7 strategies within the educational component of the National Physical Activity Plan. I've highlighted in red the key components from each strategy. And as you notice, several of them fit in nicely with the Midcourse Report. I've already spoken quite a bit on the first strategy, which is related to physical education. The second one addresses policy level, which was not a component addressed in the Midcourse Report, but an important area that can really help to increase physical activity opportunities. And the third strategy relates more actually to the built environment setting within the Midcourse Report, talking about establishing partnerships and relationships with other sectors to help increase physical activity within the community. And this next slide, I'll highlight the last 4 educational strategies. The fourth one talks about early childhood education settings, and as I also mentioned, this is a really important area to get young kids started with physical activity. And the 5th, 6th, and 7th strategy are all areas that were covered within the school setting, with before and after school programs, overall access to physical activity, and also the importance, and I didn't touch on this too much previously, but really an emphasis on providing teacher training, both in the school setting and the preschool and child care setting, is a really important area to help teachers learn what may work best within their classroom setting. So next I'd like to shift to Let's Move Active Schools. This was released in 2013 as a new component to the Let's Move initiative that has been coordinated and organized by Mrs. Obama. So Let's Move Active Schools is a comprehensive program that's focused specifically within the school setting, and their key area is to create school champions. This could be a PE teacher, classroom teacher, principal, administrator, or parents, and the idea is to create an active environment that enables all students to get moving and to reach their full potential. So Let's Move Active School incorporates physical activity opportunities within 5 key areas. And you're probably noticing a theme here that several of these are similar to what was in the Midcourse Report and also touching on what was in the National Physical Activity Plan educational strategies. So essentially for Let's Move Active Schools, it's a 6-step process that helps schools build a team, make a plan, and access free resources and tools, including in-person trainings, program materials and activation grants, and direct assistance from certified professionals. So once schools go through this process and they've achieved the goals within these areas, schools can be publicly recognized and celebrated. And I've included the website here at the bottom of the slide for more information on how to sign up. And finally, for the last portion of my presentation today, I'm going to highlight some success stories for some schools and a state who has really made some strides to increase physical activity for youth. These examples are from Let's Move Active Schools, who have done tremendous work in a variety of different ways, and I hope that by sharing these may be opportunities that you could implement in your own school or own community environment. So the first one here is from Memorial Elementary School in Natick, Massachusetts. And a lot of this work really was started with a group of active moms that really wanted to provide additional opportunities for physical activity for their kids. And so they implemented the BOX program, which stands for Building Our Kids' Success. And this is a morning program that's usually done typically before the school day, so students come to school earlier and they're doing a physical activity program prior to it. It's typically organized by parents. They may have school administrators and teachers involved, but there's typically often a heavy community and family involvement. And they've gotten some great feedback from the program so far. Teachers are reporting that the kids that are doing BOX in the morning have more confidence and a higher attention span and improved academic performance. So that's some anecdotal evidence, but showing that, getting kids started with some activity really can help them throughout the school day. Next, I'd like to shift to PE. Terrence C. Riley School Number 7 in Elizabeth, New Jersey, is doing something that many schools are far from achieving. Youth at this school are meeting the physical activity guidelines of 60 minutes or more of physical activity every day. So each day, kids have 45 minutes of PE, and then there's movement incorporated into up to 5 of their additional other classes. And this adds up to 60 minutes of physical activity daily, which is pretty amazing. And then the next one talks about activity break opportunities. The Ridge Family Center for Learning in Illinois has focused on physical activity during school, so within the school day, using classroom brain breaks. And they've also done a lot of community involvement. So they've really reached out and connected with a lot of families. And so they've done family fitness night and have students leading activities and prizes that are wellness focused. Something else this group has done is been involved with the Fuel Up to Play 60 program, which is another opportunity with free resources and information. It's a student-led program to help increase physical activity and incorporate good nutrition into the school day. And the last one is a state story from the state of Connecticut, which has worked hard with the National Safe Routes to School and the Department of Transportation to increase opportunities for safe routes to school. And so what the state has been able to do is to create a number of partnerships to promote safe routes to school, an International Walk to School Day, which is coming up this year on October 9th. They've also been able to identify some funding to put into rural and urban communities to help with some infrastructure projects, which allows more opportunities for youth to get to and from school safely. And the great thing with active transportation and changes to the built environment is really the benefit of not only the students that may use it to and from school, but also everyone in the community that may be able to use these areas as well. So this is definitely a great option to increase physical activity for youth and adults as well. And then just my last slide here, I just wanted to highlight a few of the resources that are available related to the Physical Activity Guidelines Midcourse Report. You'll see on the first side of the slide is an infographic which was created to highlight the importance of each of the 5 settings for youth to get 60 minutes or more a day. Realizing with the exception of Terrence C. Riley School that is able to get 60 minutes within the school setting, most times it's challenging to get 60 minutes in one spurt throughout the day. So this infographic was created to show each of the 5 areas and how time spent in each of these can add up to 60 minutes throughout the day. There's also a statistic found in the center of the infographic that talks about the opportunity for physical activity within that setting. And so also accompanying the infographic is a youth fact sheet, as you'll see on the other side of your slide. And in 2008, when the physical activity guidelines were released, we had an adult fact sheet and a fact sheet for professionals. So we decided to create a youth fact sheet that would also accompany the mid-course report and spell out specifically what the youth guidelines were and also give some examples of variety of activities that youth may enjoy. So I've included the website at the bottom, health.gov/PA guidelines, and this is where you can download these resources, print them, share them, distribute them. You can post the infographic image and use it in whatever way it may help you in your community. Thanks for your time.
Hi, thank you. That was wonderful, and I think a perfect segue to what I'm going to talk about. My name is Georgi. I'm the Director of Health and PE for the Fort Worth Independent School District. We have about 83,000 students on any one day. So this is going to be more from the perspective of an administrator who's passionate about getting kids healthy and the successes that we may have had in Fort Worth over, say, the last 5 years, and the barriers that we attacked. I think that one of the big barriers is our principals and administrators. They are wonderful, hardworking individuals. They will voice their support they understand the importance of children being healthy and active. And the reality is they don't think there's time. And we see that all the time with increasing physical education minutes, physical activity minutes, introducing health education, things like that. So we looked at it and we said, what can we do as a district? So we developed not only a consistent message so that our administrators would hear the same thing about why it was important, but we also developed a program where we could push this out to our schools and provide the resources that they need. And so we kind of did it at the same time, and that's where we are at now. First of all, I want to talk about the program. We had just established campus wellness coordinators at each one of our campuses. Not a new idea. Almost every idea I've ever had I've taken from someone else. But we recognized that we needed a facilitator, a champion at each campus. And we've been able to pay these people, not a lot of money, but I think if a job is important, people deserve to get paid. We recognize that if we're going to get more recess, if we're going to get activity before or after school, that means we need to provide equipment. And we might have to provide training because that type of physical activity is not like physical education, and we don't want it to be. So we have found some money and some time to bring schools in, and we're requiring a minimum of 3 individuals from each campus, and if they come to our training, then we're going to provide them the equipment because we think that the equipment should be a different color. It probably is going to be a little different type of thing. We volunteer, and I mean we health educators, physical educators, local wellness coordinators, we volunteer as much as we can at any event where parents are there. It can be PTA meetings, it can be wellness events, it can be back to school activities during the summer because we want parents to see us, we want to be able to talk to parents, and we want to spread the word. And then the last thing we do is we plan a district-wide wellness event every year so that everyone, billboards all across the district, we get the same message. This next slide is an example of that, one of the brochures that we sent home. I believe this was our wellness event last year, Move to Improve, and the brochure actually went home to the parents. The challenge was for the children to get 60 minutes a day for a week, but we wanted the parents to understand how important it was and what they could do, and we gave them ideas. And so that's how we involved the community, and that was a very successful event. This next slide is a photograph of one of these events that our district sponsored for parents. close to the beginning of the school, and we set up some activities where children could demonstrate to their parents the kind of things they're doing in physical education. And if you look in the background, you'll see some people hula hooping. We had jump roping. Always are popular. We're always a very popular booth when we do that, and we encourage the parents to participate as well. This particular slide is really one of a poster we did recently for a community event that I did, because we wanted the community to understand everywhere we go, again, that message that we're all about physical education, we're all about health education and nutrition, and we want the families involved. And so if you'll just briefly go around the poster, and you'll see where we're jammed one year, we moved to improve one year, we junked the junk food one year, we hydrated one year. This year our message is to power down. We're trying to get kids to use less screen time for recreational use, and when the brochure goes home to the parents, we're going to be giving them lots of activities where they're physically active to replace that time. So that's kind of that message that we keep wanting our parents and our children and our community to hear, is how important it is, and we want, of course, the principals to hear. Now, this next slide, I think, is really probably where we got the most interest. The first three slides talked, or however many they were, talked more about how we implemented this. And we have these wellness coordinators, and we provide activities, and we provide challenges. But this particular activity talks about how important it is that you have, for your elevator speech, in your back pocket, the impact of physical activity and good health in children on their academic performance. And those four things you see right there, increased academic performance, better behavior, increased time on task, and better attendance, will sell most principals. And so that's the message we're taking to principals. When we talk to parents, we just talk about behavior and, of course, reduced trips to the doctor and the same thing. And then because we understand that principals are just like anybody else, they like to have their successes acknowledged. We created the Golden Sneaker Award, and you can't see the plaque, but we acknowledge a secondary and an elementary campus each month for the one that did something extra, because we are challenging our schools to do even more than we're providing. And this has been a very popular thing with our teachers and principals. This billboard was something we do. This an annual event. We do a walk where we open up all our high school tracks. We have 13, and we encourage all our communities to come and walk with us for an hour. It's just symbolic. We want them to know that our tracks are available to them before and after school and on weekends, and this is just one way to highlight it. And we are working with our city on this, and this has been a fabulous collaboration to give people opportunities. This last slide is another example. We do ACES, All Children Exercise Simultaneously. Many of you are probably participating in the Worldwide Jam and Minute on, I think it's September 26th. If you haven't signed up, you need to do it. The picture on the bottom left is our annual walk. The center picture is one of our walking school bus campuses. And I know Katrina mentioned the community involvement, and I'll tell you the other thing that's been wonderful is to see children just enjoying walking to school and talking, and I've been one of the, quote, bus drivers. My favorite photograph is probably the one in the center where we've got kids hula hooping and reading, and this was not set up. This is a librarian that really decided she was going to do what she could to help us, and of course there on the bottom are some of our incentives. So it's working in Fort Worth. It's not easy, but we're keeping the message simple, and we know it's the right thing to do for kids. So thank you for letting me talk to you today.
Thank you very much, Georgie and Katrina. I would now like to hear from Mr. Martin McDonald, who is a principal at Jordan Matthews High School in Siler City, North Carolina, who's going to give us a little bit different perspective on increasing physical activity at his school. Mr. McDonald, are you there? If you could go ahead, Mr. McDonald, and press the *# and see if that is what we need to do.
All right, excuse me, I'm sorry about that. My name is Martin McDonald. I'm the principal at Jordan Matthews High School in Siler City, North Carolina, and I want to share some information about what we have done to build time into our school day for physical activity. We started JETS Time as a way to try to address the academic, social, and physical needs of our students. We first looked at doing this after school, but due to students' other obligations such as work, sports, and family commitments, we decided to build this time into our school day. We got permission from our school board to adjust our school day by adding 10 minutes to the start and 15 minutes to the end while dropping a 10-minute break, and we were able to create a 35-minute block of time into our school day. Students who scored below an 80% in any of their classes were required to attend academic support sessions during that time, but all others were able to choose from a variety of offerings. The 35-minute block of time we used to engage students in clubs, academic support, and physical activities. We polled our students to see what types of activities students wanted, and then had teachers use Moodle to create sessions that they then supervised and that the students registered for. Examples of these physical activity sessions include walking the track, tennis, kickball, soccer, basketball, ultimate frisbee, Zumba, just to name a few. One of our desired outcomes was to have students and teachers be able to build relationships during this time by seeing one another doing what they loved or what they had a passion for. At the end of the year, we reflected on the process and were pleased with the increased involvement of our students and the greater number of students able to participate in sports outside of our athletic programs, and the huge increase in club membership. But we still struggled with staff buy-in and scheduling difficulties that left us with a program that students loved, but a number of teachers felt was outside of their job responsibilities. That summer, we listened to the teachers and tried to work out some of the scheduling conflicts. We developed a new schedule plan operating during the same time of day and created a more structured intramurals program that focused on soccer, basketball, flag football, and battle ball. These were chosen due to being the most popular and for their ability to be played indoors regardless of the weather. We had 170 students, and that's about 26% of our student body, participate in the Super Team Intramural Challenge. We maximized participation by running 2 courts at the same time and playing fast-paced 8-minute games. Students had up to 8-member teams and participated in all 4 of the sports offered. Even though we played 5-on-5, they were able to sub in. One of the really cool things that occurred during this time is several of our students, or many of our students, had a particular interest area like soccer or like basketball, but typically those did not overlap. And so our African American and our white students, who were exceptional basketball players, really made the Hispanic students look like they were on roller skates during basketball. And then when we were time to play soccer, those same students who had looked so graceful the day before were the ones on the roller skates, as the Hispanic students really showed off a lot of indoor tricks and beat them quite soundly. And what we ended up happening is we started to see a breaking down of barriers on a lot of our athletic teams. We have 6 Hispanic students who, up until then, had not been participating in football, joined the football team. We've had increased participation on our soccer team, and a huge increase in the number of students and ticket sales at our soccer games. So that was an unintended consequence that we were really excited about. We then reflected some more about ways that we could improve this process. And at the same time, the 2 other high schools, impressed with our data and the results that we were getting, decided to add in their own JETS time during their school day. So this year we've begun we've renamed our JETS time into Launch. We've removed the enrichment block to the start of the school day. We still have where students who fall below the 80% mark in any of their classes have mandatory academic support during that time. but all students above the 80% mark are able to participate in intramurals, clubs, or they can arrive to school later in the morning for the start of their first block class. And even with the ability to stay at home and come to school later, most of our intramural teams have still slated to participate in this year's Super Team Challenge again this year. So I want to share with you some of the results that we had, not only of Jets Time, just other initiatives that we've enacted in the last 3 years. Our graduation rate has increased from 61.8 to 84.7%. We're above the state average. We have the highest graduation rate in our history of our school. Our composite score has gone from 65.2 to 79.8, which is the highest composite score in the history of our school. We made AYP for the first time in the history of the school in 2012. We have the highest graduation rate among Hispanic students in North Carolina. We had a 19% reduction in classes failed by students. We had a 20% reduction in the number of students failing multiple classes. We had a 22% reduction in the number of ESL students failing a class. 68% increase in club participation. Our average intramural participation rate over the last several years has been 168 students per semester. We had 121 students who were named scholar athletes during their athletic conferences. We had 10 out of our 18 varsity athletic teams be named scholar athlete teams. The number of students on the AB honor roll has increased by 11%, and we had a 19.6% increase in the number of straight A students that we have each year. So we're really excited about what this program has done for us, and I hope that you will take the opportunity, if you're in such a position, to be able to offer your own type of program. And the last slide there is some contact information if you would like to get up with me to learn more about how we made that time into our school day, or how we use that time in this third generation that we are calling now Launch. Thank you.
Thank you, Mr. McDonald. And I would now like to turn it over to Dr. Sarah Lee with the Centers for Disease Control and Prevention, Division of Population Health, to talk a little bit more about some resources that are available through the CDC.
Great, thank you, and thanks to everyone for joining this webinar. This is great participation and wonderful to hear from the co-presenters on the webinar about the science base as well as what's happening in the field. That's always very exciting. So I'm going to share different tools and resources that we have available from our school health group within CDC, and talk a little bit about some examples of how schools and school districts and even state education agencies have utilized these tools. So just to give a little bit of a background about what we do within my team and branch at CDC on the science end, our goal is really to make research come alive and make it meaningful for practitioners who work in education agencies. And as I mentioned, we focus on state, school district, and school level with these resources and research projects. So we cover a variety of different types of scientific activities, from research synthesis and surveillance, which you see on this slide, all the way down to disseminating and communicating about the science. So let's turn to this slide just briefly. I'll highlight a couple of the items that are on this slide. Right in the center where you see the bigger letters MMWR, this is really kind of a prime example of our research synthesis activities, where we examined the research that had been published over a 12-year period and analyzed every article that we included in this process to come up with not just a synthesis and a summary of what the research said, but really also moving that science into what recommendations are really speaking to us from the science. And so that's a set of what is called the School Health Guidelines to Promote Healthy Eating and Physical Activity, and it's a set of 9 specific guidelines with corresponding strategies on what schools can and should do in order to really ramp up school health programs that increase physical activity and healthy eating. Just diagonal to the left with the blue banner is a publication we published in 2010 that is still getting a lot of face time, and both Georgi and Martin mentioned that they saw wonderful benefits from activity programs, and they really promote this, not just on the health side of it, but also on the education side and looking at different educational outcomes. And that is no surprise, because in this report what we did is, again, took as much of the science that was out there that was good quality science, we combined it into a set of statements about what the science said, and in conclusion, it says that physical activity either added in the school day for more time for physical education, for example, or physical activity infused in classrooms, extramural physical activity after school, doesn't have any negative impact for certain, and in many cases actually enhances academic performance. So those are a couple examples from that slide of the type of research synthesis that exists, and all of these actually have executive summaries for folks in schools to use, so they're not reading the very extensive scientific report, but they have a more distilled version. I also wanted to highlight a couple resources that are related to the school health guidelines that I talked mostly about in the previous slide. On the left, this is a PowerPoint presentation that is for public use. It is very user-friendly to download from our website. Folks can take the slides, make them customizable to their needs in their state, their district, or their school. And it's very visually appealing as well, not text-heavy whatsoever, and not focused on the science, but really focused on what do the guidelines say, and what can schools do about those guidelines to help themselves move the needle a little bit further. We also have, to accompany the PowerPoint presentation, a facilitator's guide that just provides different examples of how schools and school districts might actually use the slide to present to school boards, state boards of education, to community organizations, to solicit more support and promotion of what they're doing in their school health programs. And then on the right, as I mentioned in the previous slide, we do write a lot of executive summaries. So that's just a 4-page executive summary that, again, just really distills down the guidelines, just highlights the guidelines, and identifies resources that schools could use to help implement the guidelines. The other type of research we do is called research translation. And this is just a set of, at this point in time, our most popular research translation tools. Right in the middle, I'm sure many of you are very aware of this, as we have over 20,000 users of our School Health Index. It's been around for quite some time, and it's evolved. Every time science evolves, we also update the School Health Index. There's a hard copy version for both elementary and then secondary, so middle and high school are combined. And there's also an online version of that tool. On the left and right are our curriculum analysis tools for both physical education and health education. And these tools are really for schools and school districts to roll up their sleeves and assess what exists in their written curriculum or what does not exist, and ways that they can improve it to help the curriculum really align with national and our state health and physical education standards. And in the middle, Katrina mentioned early on in the release of the physical activity guidelines for Americans, there was a lot of promotion and translation materials around the adult guidelines, and we determined it would be wonderful to have something to accompany what the youth guidelines said. So this is a toolkit, very colorful, vibrant, and has fact sheets, has PowerPoint presentations, has a DVD with a promotional video. That's one of our most popular tools because folks like to use that to try, again, to gain support for activity programs in their schools. And a few things I want you all to be aware of, because these are all coming very soon, some within the next 2 to 3 weeks. In particular, the first item on this list is a guide that is a really simple step-by-step guide for schools to develop, implement, and evaluate comprehensive school physical activity programs, really aligns with the Let's Move Active Schools initiative, and also aligns very, very well with the Midcourse Report recommendations of multi-component physical activity programs in schools. So it's really a way to help schools just step-by-step go through a process of creating a program, coming up with a plan for implementation, and then making evaluation seem less daunting for physical education teachers and classroom teachers in particular. We also do quite a bit of work around wellness policy and know that this is a great leverage point for schools to make change. So we have a series of success stories coming. We have a tips for teachers document that aligns with our guidelines for classroom teachers to integrate more activity and healthy eating messages and activities in their classes. And then honing in on, again, some of these points about health and academics, we are going to be releasing a series of PowerPoint presentations, fact sheets, as well as webinars and podcasts that focus on the relationship between healthy eating, physical activity, and academic performance. And then finally, a series of briefs and fact sheets on local wellness policy, content, and strengths. One of the last pieces I would like to highlight that is available at very low cost and free in some cases, we have what is called the Training Tools for Healthy Schools Network, and this is a big training network we've created that we create a cadre of master trainers. We bring folks into CDC, train them on how to deliver workshops, and they deliver workshops on some of our most popular tools and resources, including the guidelines. So I use that as an example here, that is a 4-hour workshop. You could request through the website at the bottom of this slide, and just gives folks a chance to get into the guidelines and learn how it's applicable to their setting and what they can do as action steps. And there's my contact information. If you have any questions about any of the resources that I went over, please feel free to contact me. And then there's a link here, which I believe is also up in the right-hand corner of your screen. And this is a link to our, what we call our Select Tools and Resources document. It's on our website for download and gives more details about our most popular tools and resources. So thank you again for having me today. It's been a pleasure hearing from everyone else as well.
Thank you, Sarah, and I want to express just a very special thank you to all of our presenters who have really done an excellent job providing the background of the importance of why we need physical activity in our schools, the special relationship that can be built with the students and the staff across districts and schools, and I'm just so impressed with all of the resources that have been shared here today. We do have a few minutes for a question and answer, and we do have a couple of questions that have already come in. But if you do have a question, there is a Q&A pod that just popped up on your screen. Feel free to go ahead and type any questions you have for our presenters in there. A couple of the questions to get us started. One is, Mr. McDonald, someone was asking if you could just rename the 4 sport activities that were provided during JET's time.
Yeah, I'll be happy to. So the 4 sports opportunities that we do now is 5-on-5 basketball, 5-on-5 soccer, 5-on-5 flag football, and 5-on-5 battle ball, which is kind of like dodgeball with a smaller, less painful ball.
Sounds good. And then there was another question about whether or not there was a fee associated with the intramural sports.
We are a high-poverty school, so we're about 70% free or reduced lunch, which I think is a little bit underrepresenting the poverty of our school and our community. So we are very conscious of not adding any additional fees, so we don't have any fees associated with any of our intramurals or our athletic programs.
Okay, great. And then one last question that just popped in for Mr. McDonald. Did your PE teacher embrace the program?
Yeah, my coaches really embraced the program. My PE teachers did. Many of my teachers did. There's just a handful of people who just felt like it was so far outside of their comfort zone and what they'd been expected to do in the past that they just couldn't seem to get on board with it. But overall, I'd say 80% of my teachers were certainly behind it, and the biggest supporters were actually my arts teachers and my PE teachers and coaches.
Great, thank you. As a more general question, someone was asking, what are your thoughts about programs like Spark or Catch and Project Fit America and where they all fit in? So perhaps maybe Katrina or Sarah?
Well, this is Georgi.
Okay, Georgi.
Catch and Spark are wonderful programs, and they have coordinated health programs and PE programs and all sorts of things. But I think that they would all look as resources, because the problem with any program, it's not going to necessarily fit what you do. And I think that was what's so wonderful about our story about the high school, is we're all saying, well, we'd like to hear more about it. But I think you'd have to recognize that the high school in Minnesota is going to have to tweak it a little bit. So I think that the idea is to change the culture of the school, not just by a program. So I think anything you're cautious with that, you have to really sit back and think about changing the culture.
Okay, great, thank you. Mr. McDonald, what makes you as an administrator enthusiastic about incorporating physical activity into your school? It says that you went to great lengths to make this happen. So thinking about the challenges that you face to overcome them.
So that's one of those questions I could spend 2 hours probably talking about. But what I think it all comes down to is I love my kids. I think my students are the most amazing young people in the world, and I think that schools exist for children and not adults, and I want to provide the type of environment for my kids that I would want for my own children, and I wish that I had as a young person as well. So those were our guiding principles, and when we initially started off, our initial discussions were nowhere near as ambitious as where we ended up. And I certainly understand that we are ambitious, and we just talked about a small component of what we do with our JETS time. Sometimes I feel like I need to apologize for how ambitious our project was, but it all comes down to just my love and my passion for my students, who I think are the best in the world.
Wonderful, thank you. There's just a comment saying, thank you, Mr. McDonald, for being such an inspiring educational leader, and I think there are many on the webinar that would echo that here today. And unfortunately, I wish that we had more time to get to more questions. One of the questions was regarding where to get a copy of the PowerPoint. If you look in the upper right-hand corner of your screen in the Files pod, you'll see the webinar slides are available there. Just highlight it, click on it, and then click the Download Files, and you should be able to access them there. I will also send them out following today's webinar. So with that, I would also like to say another special thank you to our presenters. I'm going to go ahead and just open our webinar evaluation. It should pop up in your browser. If you have any additional feedback for us, your feedback is important to us, and we do strive for continuous improvement, so please feel free to complete that. We also would ask that if you have any other additional questions about programs or resources, there's a form that you can complete in there as well, and we can certainly get back to you. Tomorrow you will be receiving some more additional information about all of the resources that are provided here today. I also want to point out that in the upper right-hand corner in that Files pod, the JETS Time case study that Prevention Partners wrote up about the work that Mr. McDonald has done in his school is available there as well for download. So please feel free to click on that and download as well. And so once again, I just want to express an extra special thank you to Dr. Katrina Piercy for sharing with us the information about the Midcourse Report, Georgi Roberts with the Fort Worth Independent School District and all that she's been able to accomplish there, Mr. McDonald and Jordan Matthews High School, and Sarah Lee, thank you again for sharing all of the resources that the CDC has to offer. I look forward to seeing all of the new things coming down the pike in the next couple of years. So with that, all of you that are on the webinar today, today. Thank you again for your questions, and thank you for joining us today. We all have a very important job working with our schools and our young people to increase physical activity wherever they are. So be those agents of change in your community, and if there's anything more that we can do, please feel free to reach out to us here at Prevention Partners. We're more than happy to answer any questions you may have. Thank you, and have a great rest of your day.